Hi, we're going to talk about epilepsy and seizures today. So the trick is that there are multiple types of seizures, and this is basically for you to help your friends and strangers. General steps you'd stay with the person until they're fully awake, comfort them, speak calmly, see if they have a medical bracelet that they know they have seizures, keep yourself calm, and then make sure that they get home safely. There are four types that I'll cover: grand mal, petit mal, which is absent seizures, focal seizures, and pseudo seizures. 911, should you call 911 if they've never had a seizure before, if it lasts a long time, if they're turning blue, if it happens in water, or if they've damaged themselves during the seizure, you got to call 911. Otherwise, if they've had a lot of seizures, they don't seem to be in danger, calling 911 can actually be very traumatic and very expensive for them. Grand mal seizures, tonic, clonic, very scary and life-threatening. Here's a gentleman so he's about to have a seizure. If you notice, he's coloring. He's already set up with his EEGs. He's having a thing now. If you watch, he's going to start to go into it. He starts to pause. It looks like he's frozen. And then he starts to go into a full seizure. Where is he going? Okay. There he is. He's turning, and there his arm goes to the left. Now he's going to cry out. I've blocked the sound, but the cry out is literally all of the air escaping from his lungs. You see, he's in full clonic at this point, so he is actually not home at all. He is somebody who won't respond to any loud noises. He won't respond to anything else. His whole body is locked out, which is going to give him a lot of. Imagine holding this much tension in your body for this period of time. It's going to be very, very hard for him to recover from this. It's like doing a push-up for 5 minutes or something. And his eyes are open. They're non-responsive. They're hooking him up with stuff. They'll suction suction liquid out of his lungs. But for the most part, they're going to leave him alone, and he's in a fairly safe position. So that's a grand mal seizure. Onward. Grand mal can be triggered by other health problems, extremely low blood sugar, high fever, or stroke, which is why you want to check it. If somebody's never had a seizure before, it could be triggered by something else, and they could be having a stroke. So you want to send them in if they have that. Crowd search, some done gently, make sure they aren't hurt, make sure you're safe first. People rarely do that. You got to make sure everybody's safe in the area before you start trying to engage them, and then try to help them. Do not put stuff in their mouth. Okay, never do any of the following. Don't put anything in their mouth because it'll actually damage their teeth. There's a lot of discussion about putting things in the mouth. The only issue is if there's a lot of saliva production. You can't actually swallow your tongue. There's a lot of saliva production. You may want to tip them on their side. It'll drool rather than have them just kind of choke on it. But for the most part, the idea of swallowing your tongue is an idiomatic expression that's saying the person who is unable to speak. It's not something, but you'll still see it in a lot of literature that people start sticking stuff in their mouth, or they'll have somebody stick a piece of leather in their mouth. And like, it's not necessary, and you're probably going to damage that person. So please don't do that. And don't do CPR. If they can breathe, they're fine. And You basically don't give them food or something. That's just weird. Petit mal is an absent seizure. Absent seizures can look a lot like ADHD, except that absent seizures, their EEG shows that their whole brain has just fritzed on them. Absent seizure, generalized seizure. This is I'll show you the first young woman. She's talking away, and then she stops. So here she goes. These are absent seizures. She's talking about them. This is a lovely young woman, and she's right. So notice she says, "Oh, pardon." She's literally wasn't there. She's learned to mask it, but that is, for the most part, absent seizures. This is a lovely young woman named Ella. Ella's absent seizure explained by Ella. She actually goes through the whole process, and what's amazing about it is that while she's talking to you, you don't notice, but she's having 5 seizures while she's talking to you. And they go back through, and she goes and she marks where she's having each seizure, but you can't see because Ella's learned to mask it, and she'll do these little facial expressions or whatever, rather than letting you see that she's not home. But she's literally general absence of seizure. And also, Ella's thing is worth watching because people keep thinking she's making it up for some reason. Her brain is fritzing. We can show that the brain is fritzing, but people think she's making it up, which is troubling. But let's move on. I don't want to show all that. Focal seizures show up Person is basically, if I start doing a soliloquial seizure, I will go blank, and my hand might start twitching. It looks like I might be having a stroke or something, but I'm non-responsive, and then I'll come back after a minute or two. They usually, people will know they have them after a first time. Focal seizures are only happening in one part of the brain. So that's why you're not seeing the full grand mal expect. But a focal seizure can turn into a grand mal seizure. That's really good. We're useful to know about. Somebody starts doing that, and then they go into full grand mal. You saw that with the first guy. He started kind of going over to the right, and then he went to the grand mal seizure. So that was kind of a focal to the grand mal. And what's happening is part of the brain's getting very much electrical activity, and then it can expand to the whole brain. That's the transmission. Or focal can just be one part of the grand mal. Okay, onward. Let's keep going. Focal seizures can be any number of things. They can just be a smell. They can be very mild, or they can be very advanced. Pseudo seizures is the thing I wanted to get to. So pseudo seizures are things that don't show up as seizure activity on an EEG. When you hook up the brain, there's no change in the brain activity, but they still look exactly like grand mal seizures at times. How you tell? It's incredibly difficult to tell unless the person's actually wired up to the EEG and you can see what's happening. Otherwise, they can be indistinguishable from a number of other kinds of seizures. Shouldn't make a diagnosis or shouldn't say, hey, this person's faking it, unless you know for sure that this is something that, or they don't need help. But the key thing, the reason for pseudo seizures, the reason we need to talk about them is that people will not respond to anti-epileptic drugs. So epileptic drugs will be given for somebody who's in an epileptic seizure to help them come out of it. Someone who's in a pseudo seizure, they keep giving the drugs until the person dies. And so you really need to know what a pseudo seizure looks like versus an epileptic seizure. It's about 20 to 40% of seizures, actually, and about 10% of status epilepticus, I can't say it, but people who can't stop seizuring, 10% of those are actually pseudo seizures. It's not the brain firing off. There's other stuff happening in the body, in the brain. It's a conversion disorder. It's often caused by PTSD. The person's not consciously feigning it. They're not constantly faking it. And the way to tell that from somebody who's faking it is, people who are faking it will typically have seizures on a convenient time, like, oh, I'm about to take a test, I'll have a seizure. Or I'm about to be arrested by law enforcement, I'll have a seizure. I'm like, that's very convenient. It may happen, but most of the time when you're having a pseudo seizure, it's not because you want attention or you need attention. It's just happening to you. I think the best way to think about it is, think of it as a body version of a panic attack. There's mental panic attacks and there's physical panic attacks. And that's the way to think about a pseudo seizure as a prolonged physical panic attack that's not under somebody's control. You can't just tell them to snap out of it, but it looks different from a grand mal seizure. Massive doses of medication have been given to these people till they die. So up to 1 in 5 patients have this. It's quite dramatic. And it's kind of, I like the other term, the dissociative convulsion. So the person's not home, but they're not having a massive electrical change. They've dissociated entirely, so their body is twitching. Um, it's a real condition in response to real stressors. They're not consciously produced. They're not the patient's fault. You need to know that. They have a gradual onset. They have a lot of motion. The eyes are tightly closed, and if you open the eyes will close again tightly. That's one sign. There's automisms. There's very rarely incontinence. People in grand mal seizures tend to pee and poop themselves. People in pseudo seizures won't. Their mouth tends to be very tight in pseudo seizures as well. So it's very rapid onset. It will tend to last a very long time, which is very frightening for everybody else, because in every other situation, a long seizure means you need to go call 911. In this case, you need to know if the person has a diagnosis of pseudo seizures, in which case it may not be necessary to call 911. Always, when in doubt, call 911, please. So, startle response, that will startle somebody in a pseudo seizure, but a grand mal, there will be no response. Eye and jaw closure, people are very close, and there may be stuttering afterwards, but the eye and jaw closure can be signs of it, and the startle response can be signs of it. The ability to come in and out of the seizure is also a sign. It's like the grand mal guy is in the seizure the whole time, but be able to kind of come in and out of it is more common. Combinations, you can have both grand mal and dissociative seizures. That's possible. And frontal lobe stuff, you can have undressing, obscenities, like Tourette's type stuff if there's a frontal lobe involvement. So seizures can be very bizarre. Faking it, malingering, does they receive any practical benefit? Often not. Does attention alone be a reason for faking it? No. Or does the attention they receive match the sympathy they might expect? Most of the time when people think that you're faking a seizure, even that poor woman, poor girl Ella, who actually has absence seizures, people think she's faking it for some reason to get attention. And for the most part, the attention people receive is very negative. There would be no conscious or reasonable reason for anybody to fake seizures, um, for the most part, unless you happen to be trying to avoid being arrested or you happen to try to be like looking for drugs or something. Those are the only two kind of semi-legitimate reasons someone would fake a seizure. Otherwise, people are not faking it. They're having a seizure. Don't kick your friends and tell them they're having a fake seizure, please, ever. That person's probably having a very bad day already. 3 points to consider. People who have pseudo seizures tend to actually keep having the seizures when they're hooked up to EEG. If someone's faking it, they will immediately stop having the seizure as soon as the EEG is hooked up, because they know they're not actually having a seizure, and they know the EEG will show that. So they'll stop having the seizure as soon as it's hooked up, and then as soon as it's gone, they'll start having them again. So that's a real pretty good sign of faking. People who with dissociative seizures, they keep doing it, and it's clear that it's not the brain activity, but it's still like a PTSD thing. More deadly to the patients, they have a lot more medication given to them, and they typically have non-normal EEG readings that are not diagnostic of epilepsy, but can be non-normal. So many of these people can end up on epileptic drugs, even though they don't have a full epileptic seizure. So, and the drugs aren't effective, so they end up over-medicated, which is why we're talking about it. Let's study more restrictions. Some people think that people with dissociative or PNES seizures, the pseudo seizures, shouldn't be able to drive. Um, that's not conclusive at this point. So that's what I wanted to do, is talk to you all about these seizures. Hopefully it helped you clarify some things. And thanks for listening.